When people think of Cuba, they might picture classic cars, cigars, or beautiful beaches. But Cuba is also known for its powerful medical system. Despite limited resources, Cuba stands tall as a healthcare giant, earning global respect for its commitment to health. Cuban doctors are often first to arrive in crisis zones, bringing hope and care to those in need. At home, healthcare is accessible to all, making Cuba's system a symbol of resilience and dedication. After the 1959 revolution, Cuba made a bold promise. Healthcare would be a right for every citizen. The government rebuilt the system, training new doctors and focusing on prevention and community care. The heart of Cuban healthcare is the family doctor and nurse program. Teams living in neighborhoods, building relationships, and keeping people healthy where they live. Before 1959, Cuba's healthcare was deeply divided. In Havana, the wealthy enjoyed modern clinics and luxury hospitals, while most rural Cubans had little or no access to doctors. For the poor, illness often meant suffering or death, as care was expensive and far away. This unequal system fueled resentment and became a driving force behind the revolution. When Fidel Castro's revolutionaries took power in 1959, they declared healthcare a fundamental human right, free and universal for all Cubans. Private hospitals were nationalized, creating a unified public health system. Clinics reached every corner of the island, focusing on the most neglected. Massive campaigns eradicated diseases like polio. This revolutionary promise still shapes Cuba's healthcare today. After the revolution, Cuba faced a devastating crisis. Nearly half its doctors left, unsettled by new socialist policies. Hospitals were left empty, and the dream of universal healthcare seemed doomed. But instead of despair, the government trained a new generation of revolutionary doctors committed to serving society. This bold response turned crisis into opportunity, laying the foundation for Cuba's future medical success. Cuba's medical strength is rooted in its unwavering commitment to education. After the revolution, training doctors became a national priority, essential for universal healthcare. Medical education was made free, removing financial barriers and opening doors for talented students from all backgrounds. Entry is based on merit, not wealth, unlocking talent across Cuban society. The 6-year curriculum is rigorous and deeply integrated with the public health system. From year one, students are immersed in community medicine, learning practical skills alongside theory. Standardized training ensures consistent excellence nationwide. The focus is on primary care and prevention, producing skilled general practitioners rather than just specialists. Every graduate completes a family medicine residency, serving in local clinics to build a strong foundation in primary care. Lifelong learning is expected, with ongoing training to keep skills sharp and knowledge current. This culture of continuous education keeps Cuba's medical workforce adaptable and effective. The result, a nation of doctors prepared to meet the evolving needs of their people. In Cuba, medical education extends far beyond the classroom. Students are assigned to local consultorios from their first year, working alongside experienced doctors and nurses. They participate in home visits, health surveys, and vaccination campaigns, learning how social factors impact health. This early hands-on exposure grounds their knowledge in real community needs. At policlinicos, students rotate through various departments: dentistry, pediatrics, gynecology, gaining a holistic view of healthcare. This practical training prepares them to work in any environment, urban or rural. Constant community interaction instills empathy, trust, and a sense of social responsibility. Cuban doctors learn to see the person, not just the disease. By graduation, they are not only clinically competent, but also deeply connected to the people they serve. Their role extends beyond treating illness. They promote health and prevent disease. This approach produces doctors who are both skilled and compassionate. The community is their classroom, shaping them into true agents of public health. In Cuba, medicine is a lifelong commitment to service. The Latin American School of Medicine, ELAM, is Cuba's boldest statement on global health. Founded in 1999, ELAM offers free medical education to students from over 100 countries, especially those from underserved communities. The only requirement: graduates must return home to serve their own people. ELAM's curriculum mirrors Cuba's, emphasizing primary care, public health, and social responsibility. Students are trained to work in low-resource settings and to address the root causes of illness. The school is a hub of diversity, solidarity, and humanism. ELAM graduates are not just doctors, they're change-makers, bringing Cuban values to the world. Tens of thousands have returned to their countries, establishing clinics and leading public health efforts. Through ELAM, Cuba's investment in education becomes a global force for good. It proves that medicine can be a tool for justice and compassion worldwide. Cuban medical training is about more than science. It's about service. From day one, students are taught that medicine is a calling rooted in solidarity and humanism. Inspired by figures like Che Guevara, doctors are expected to serve wherever they're needed most. The family doctor model fosters close bonds between physicians and their communities. Doctors live among their patients, breaking down barriers and building trust. This approach creates a collaborative, respectful relationship between doctor and patient. Cuban doctors are role models, embodying selflessness and dedication. Their holistic care addresses not just illness, but overall well-being. This culture of service distinguishes Cuban healthcare at home and abroad. It drives the nation's international medical missions and inspires thousands to volunteer globally. For Cuban doctors, medicine is a lifelong commitment to humanity. Cuba's medical influence reaches far beyond its borders through medical diplomacy. Since 1963, Cuba has sent thousands of healthcare professionals abroad, starting with a mission to Algeria. These armies of white coats serve in over 160 countries, bringing care to underserved communities worldwide. Cuban medical missions are rooted in the belief that health is a universal right, not limited by borders. Volunteers staff hospitals, run clinics, and train local workers, building sustainable health systems. Their work is about capacity building, not just temporary aid. Cuban doctors receive modest stipends, motivated by solidarity and gratitude for their own free education. This spirit of internationalism is a source of national pride. The White Coat Army showcases Cuba's commitment to global cooperation and humanitarian values. Their impact is felt in remote villages and bustling cities alike. Through these missions, Cuba demonstrates that true power lies in healing, not in force. The world recognizes Cuba as a leader in medical solidarity. When disaster strikes, Cuba's Henry Reeve Brigade is often first on the scene. Formed in 2005, this specialized unit responds rapidly to crises worldwide. Volunteers are trained to work in the toughest conditions: earthquakes, epidemics, and more. In Haiti's 2010 earthquake, they set up field hospitals and treated thousands. In West Africa's Ebola outbreak, Cuba sent the largest foreign medical team, risking their lives to save others. The brigade's work is globally recognized as heroic humanitarianism. Their readiness and discipline reflect the core values of Cuban medicine. These missions are more than medical aid. They are acts of compassion and hope. Cuba's doctors bring healing where it's needed most, earning respect as a humanitarian superpower. In a world of crisis, Cuba sends doctors, not soldiers. Operación Milagro, or Operation Miracle, is Cuba's ambitious program providing free eye surgery to those in Latin America and the Caribbean suffering from preventable blindness. Launched with Venezuela, it's restored sight to millions, giving back independence and hope. For many, it's truly a miracle, transforming lives and building solidarity across the Americas. Cuba's medical diplomacy has transformed global health, sending doctors to countries in need and filling critical gaps in care. These missions build goodwill, strengthen local health systems, and earn Cuba respect on the world stage. Even under pressure, Cuba's network of grateful allies stands strong, proving that a small nation can make a massive difference through solidarity and care. Cuba's healthcare system has achieved remarkable victories, eradicating diseases like polio, measles, and whooping cough through nationwide vaccination campaigns. Their proactive fight against dengue, with mass mobilization and community education, keeps outbreaks in check. Cuban scientists even created the world's first meningitis B vaccine, saving countless lives. These victories show the power of collective action and Cuba's unique approach to public health. Cuba's medical success is not just about public health, but remarkable scientific innovation born from necessity. Isolated by the U.S. blockade, Cuba built a world-class biotech industry, led by the Western Havana Scientific Pole. Their breakthrough, Heberprot P, treats diabetic foot ulcers and has changed lives worldwide. During COVID-19, Cuban scientists developed their own vaccines, proving innovation thrives even under pressure. Cuban healthcare's success goes beyond hospitals and clinics. It's rooted in a holistic vision of health. Here, health means complete physical, mental, and social well-being. Family doctors care for entire communities, monitoring nutrition, living conditions, and social factors. Programs like maternal and child health ensure personalized care and low infant mortality. For seniors, community groups promote active, healthy aging and connection. In Cuba, true health is built on care, compassion, and community. Cuba's journey to medical success began with a revolutionary promise: healthcare as a right for all. Despite immense challenges, Cuba invested in education, prevention, and community care, building a system focused on people, not profit. Sharing its doctors worldwide, Cuba became a humanitarian superpower, proving that vision and commitment can transform a nation. The Cuban healthcare story offers profound and timely lessons for countries around the world, regardless of their political systems or economic status. The first and most fundamental lesson is the incredible power of political will. Cuba has shown that when a government truly prioritizes the health of its population, remarkable achievements are possible, even with limited financial resources. By defining health as a public good and a human right, rather than a market commodity, it is possible to create systems that are more equitable, efficient, and effective. This challenges the widely held assumption that high-quality, universal healthcare is an unaffordable luxury. Secondly, Cuba's model highlights the immense value of a primary care and prevention-focused approach. In many countries, healthcare systems are sick care systems, heavily weighted toward expensive, high-tech treatments for advanced diseases. Cuba proves that investing in community-based family doctors, health education, and preventative measures is not only more humane, but also more sustainable. Keeping people healthy is far more cost-effective than treating them once they are sick. This lesson is particularly relevant today, as nations everywhere grapple with rising healthcare costs and the growing burden of chronic, non-communicable diseases that are often preventable. Another key takeaway is the importance of investing in human capital. Cuba's response to its early brain drain was not to import foreign talent, but to build its own, creating a vast pool of highly trained, socially committed professionals. The success of ELAM further demonstrates a model for training doctors who are dedicated to serving underserved communities, directly combating the global problem of medical brain drain. This focus on people over technology or infrastructure shows that the most valuable asset in any health system is a well-trained and motivated workforce that is deeply connected to the communities it serves. Ultimately, Cuba's enduring legacy is its powerful demonstration of what is possible. It provides a living example of a health system built on solidarity, compassion, and the unwavering belief that everyone deserves the best possible care. While the Cuban model cannot be simply copied and pasted elsewhere, its core principles, universal access, a focus on prevention, community integration, and global cooperation, offer a valuable blueprint for building healthier and more just societies. In a world facing immense health challenges, from pandemics to growing inequality, the untold story of this small Caribbean island offers not just inspiration, but a practical and hopeful path forward.